I'm not involved in any Duchenne company currently, but look, you form real connections with these people. You know, when you get those calls and you're talking on the other end of the phone with a mom who's trying to save their boy, or a dad who's trying to, you know, save their family, you want to help them, right? And you feel an obligation. There's almost a duty to do everything you can in your power as a biotech CEO to serve, right? You know, those patients. I mean, at the end of the day, that's why we're all in this industry, is to help patients. So when you're interfacing with them directly, right? You know, who am I as a biotech CEO to sit on my perch and say, well, you don't understand the business I'm in, right? And you know, you should just go back and just wait for us to do our work. It really changes you to say, well, wait, I have an obligation to take this data set that we had at Sarepta and do everything I could to just ask the question to the FDA, will you consider accelerated approval? We weren't supposing anything. We weren't, you know, going rogue and saying we're going to, you know, submit an NDA and we don't care what the FDA thinks. We actually said we're going to go through the process the right way and ask the FDA if they consider this a data set worthy of what Congress was saying, which is, hey, start to use accelerated approval more for rare disease. And so, you know, I wasn't going to negotiate against myself, right, to say, oh, it's too early. I felt an obligation to say, you know, let's try, you know, and they might say no, but let's try to do this. Now, what I think was mistaken, you know, across the Sarepta story was that the idea that we were encouraging the advocates, or that we were, you know, that you know, we were this puppeteer and telling them, you know, when to go to the FDA and what to say. Honestly, once they knew the data and once they understood the opportunity of accelerated approval, they started to run it. Every advocacy was different. You know, each foundation took a different approach, but all of them universally wanted to find a way to get the first Duchenne drug approved in the U.S., right? And so at that point, when we had, you know, as a public company, when we were sharing data or we were sharing minutes that we were getting from the FDA, they were acting before we even had a conversation, right? Because as a public company, they were seeing things for the first time as investors were, right? You know, actually the FDA usually saw our press releases before we put them out. You know, we did that to just make sure that they were comfortable with what our communication was around FDA, you know, interactions. But, you know, that's when, you know, obviously after I left even, they had the largest advisory committee public hearing ever. More people showed up. They had more testimony from not only families, but from physicians and researchers than had ever been done previously. The first time ever they had an advocate present as part of the industry presentation, not the public hearing, but the industry presentation to talk about patient-reported outcomes, and that was done with the FDA's approval. So there was a lot of unprecedented activity around the Sarepta approval that, you know, much of it happened on my watch, much of it happened because of what we started after I left. But again, all of it, I think, somebody and a company had to be the first to figure out how this new landscape was going to play out. And I think now it's become almost industry standard. And the FDA is part and parcel of that. If you look at what you know, Dr. Gottlieb's recent communications around engagement with patients and how they do, you know, this is what they were starting to do during the Sarepta experience that now is becoming more formalized. So I think, look, it's never fun to be first. And you know, when you have to kind of run through that wall to test things out, you know, there could be casualties along the way. But you know, I have no regrets being in that position, and you know, very pleased with the direction Sarepta's taken, and they seem to have. I don't know Doug Ingram personally, but he seems to, you know the technology and has a great vision for the future, and you know, happy to see them you know, doing the right things to move the company forward.